Okay, welcome back to our discussion on upper cervical chiropractic care and multiple sclerosis. We're going to talk now about MS, major theories behind what's going on in MS, who experiences it, symptoms, things like that. So let's go ahead and get started. Right in front of you is a web page from WebMD. This is where I would go if I were to be looking up information kind of as an average healthcare consumer about MS. And right there it tells us that MS is the breakdown of the nervous system, specifically the central nervous system. Around a particular part of the central nervous system, the myelin sheath. And now the myelin sheath is like a sleeve that goes over nerves, and this sleeve acts as like a grease for nerve signals. So the myelin sheath, which wraps certain kinds of longer nerve fibers, helps the body send messages faster from the brain out to the body and then from the body back to the brain. And as this sheath breaks down, then it forms scars. Another word for scarring is sclerosis. And these scars, or these plaques, then act as more or less speed bumps for the nerve signals rather than grease. So you have this incoordination then in the communication between the brain and then the body, and then incoordination within the brain itself. So that can lead to a number of interesting symptoms. Let's go ahead and look at those. So we can't do the whole MS experience justice. Each case progresses a little bit differently. Not everybody gets the same kind of symptomatology, but what ends up happening is the muscle systems in the body are affected. There may be cognition affected, eyesight may be affected, and of course all these things develop sometimes over months, sometimes over years. Where chiropractors end up usually seeing MS patients is in kind of managing these muscle aches and pains from the muscles being in spasm, an increase in tone in the musculature, and then the paresthesias, the numbness and the tingling in the arms and the legs. Let's go ahead and look at what may be causing MS. And the long and the short of what causes MS is medical science still doesn't really know. There's a really good theory out there that MS is actually an autoimmune disorder. Autoimmune disorder meaning that the body is attacking itself with its own antibodies, that the body has become sensitized to a certain part of itself, and now the immune system is attacking that part of the body. And so in this case, of course, the myelin sheath. MS generally happens in women more than it does men. It happens in Caucasian women more than it does other women. And it happens to people in northern latitudes, so northern US, Canada, northern Europe, more than it does other kinds of people. So that suggests a certain kind of genetic component. And then there may be another factor to the genetic component, genes combined with perhaps an exposure to an environmental toxin, maybe a virus at some point in life. So those are the major theories out there. And let's go ahead and share with you some new information that's coming from a researcher out of Italy. So this is new information coming to us from the BBC. I'm going to go ahead and read it. U.S. scientists are testing a radical new theory that multiple sclerosis is caused by blockages in the veins that drain the brain. So we're not talking about necessarily an autoimmune disorder. This may play a role in it, but this is looking at it from a mechanical perspective, not from an autoimmune or a chemical reaction within the body necessarily, but a mechanical cause, possibly, of MS. So let's go ahead and read further. The University of Buffalo team were intrigued by the work of Italian researcher Dr. Paolo Zamboni, who claims that 90% of MS is caused by narrow veins. So these are narrow veins, not in the arms or the legs, but narrow veins at the top of the neck, most likely the base of the brain, possibly going up into the brain or skull cavity. So this is let's take a look at some of this work. So this is the research, or at least some of the research that the article was referring to. This came out in April 2009. You can find this on PubMed, of course. The title is Chronic Cerebrospinal Venous Insufficiency in Patients with Multiple Sclerosis. What that basically means is lack of proper vein flow in certain part of the body. Cerebrospinal, speaking about the interaction between the brain and the spinal cord with people with MS. And just to go ahead and detail a few of the things that they did in this research. They took Doppler high-resolution exam of these folks and looked for abnormal venous outflow coming out of the skull. And they're going to do that here in Buffalo, New York. So back to the BBC article. The Buffalo team is going to recruit over 1,000 people who have MS, and they were going to use Doppler ultrasound like they did before. And if they can prove Zamboni's theory of chronic cerebrospinal venous insufficiency, they say it will change our understanding of MS. So we're going to talk about that and how it relates to upper cervical care next.